Good morning, everyone. We'll start today's briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. Joining us this morning are Dr. James Hildreth, President and CEO of Meharry Medical College, Dr. Adrian Battle, Director of Metro Nashville Public Schools, and Burke Nihill, President and CEO of the Tennessee Titans. Butch Spiriton, President and CEO of the Nashville Convention and Visitors Corp., Director Chief William Swan of the Nashville Fire Department, and Dr. Michael Caldwell from the Metro Public Health Department are here to help answer your questions. We'll begin now with Mayor John Cooper.
Good morning, Nashville. Now, I'm just going to take a moment. It's great to be here and not at the EOC, so thank you all for coming out. Before we review today's COVID-19 numbers, I want to acknowledge Nashville's first responders and other Metro personnel who have deployed to Florida. As part of the Tennessee Task Force 2, we wish them a safe deployment as they assist those affected by Hurricane Sally. Now today, Nashville is in the same slow, steady progress to curb the spike over the past 2 months. Progress that has helped Davidson County go from #1 worst now to 82nd among Tennessee counties in daily cases per 100,000 residents. Had we stayed at #1 worst, our daily case count would be over 700 cases a day instead of the 130 new cases that we see this morning today, and our 14-day average is 100. Now, Nashville is a major metropolitan area and an international business and tourism destination, a densely packed and interwoven community that has all the makings of a perpetual coronavirus hotspot. But we have not stood still. As a community, we took decisive action to flatten the curve in the absence of a coordinated national COVID-19 response. And the success of our coronavirus response is a direct result of your efforts. Nashville's 7-day positive rate peaked at 17.1% on July the 9th. Today, it is 5.1%. Our 7-day rate of new cases peaked at 64.7 per 100,000 residents on July the 13th. That metric is 15.6 as of this morning. Now, as I mentioned last week, we've made significant progress in our COVID-19 response efforts. But our work is far from over. We must remain vigilant. If we don't proceed with caution over the next days and weeks, our progress may be lost, and the decisions made today could be changed in response to those facts. And as we do our very best to keep ourselves and community healthy, we also have to apply the lessons we've learned this year to further adjust the dial of our economic reopening strategy, a dial that can be readjusted as our metrics demand. Now today, I'm pleased to announce that the Titans' first October home game against the Steelers will be open to in-person fans at 10% capacity. According to the Safe Stadium Plan, a comprehensive public health protocol for all sporting events at Nissan Stadium. Among the many important rules and provisions to keep spectators healthy, the Safe Stadium Plan provides for a 20-to-1 security personnel to fan ratio to help ensure attendees are wearing face coverings and maintaining proper social distancing from each other. And based on the outcome of these safety protocols on October the 4th, the October 11th home game will be open to in-person spectators at 12.5%, and the Titans-Texans game will be open at 15%. Now this morning, I'd like to welcome Burke Nihill, President and CEO of the Tennessee Titans, who is here to tell us more about the Safe Stadium Plan and how it will keep all visitors to Nissan Stadium healthy in October and beyond. And also beginning on Friday, September the 25th, the fall MNPS interscholastic sports season will also resume for both student athletes and their families, but with rules and regulations in place to minimize any spread of the coronavirus. All events will take place outdoors, and staff and students will agree to a strict COVID-19 safety plan. Again, our COVID-19 numbers leading up to September 25th must remain reasonably steady for our students to be able to safely take the field. Now, today, Dr. Adrian Battle, Director of Metro Nashville Public Schools, is here to discuss the start of the fall sports season for our students. And they have worked so hard to prepare for competition this year. Now, finally, beginning tomorrow, all bars and limited service restaurants can operate at 50% capacity with social distancing in place, with a maximum of 50 patrons per floor and 50 patrons in an outside dining area. And these establishments can also stay open until 11 p.m. nightly. The Honky Tonk Heroes campaign, an initiative of the Nashville Convention and Visitors Corp., has been instrumental in spreading good public health practices across our hospitality and tourism industry, especially among customers and businesses in our downtown core. And I am grateful to all the bars and restaurants that have stepped up their efforts to protect the health and safety of their patrons. Now, in recent weeks and months, I've had the opportunity to closely observe other NFL cities and school districts to gather best practices and adopt public health protocols that are necessary to safely get our students and fans back in the game. We also learned to make incremental changes to our economy that help all our residents safely get back to work based on what we have learned to combat this new disease effectively. Throughout the pandemic, Nashvillians have learned to live, work, and play in ways that still minimizes the risk of the coronavirus as much as possible. It's the reason we all wear masks, wash our hands, stay mindful of healthy habits, in order not to spend our days isolated at home, but also to safely rebuild and re-engage the community that we call home, where no Nashvillian is left behind. Healthy habits, face covering, social distancing will protect lives, revitalize our economy, ensure our students can resume in-person learning on schedule, and create a path to begin phase 3 of our roadmap on October the 1st. The markers of this next phase will be public school teaching in person, increased capacity at event spaces, and attendance at larger events. We will learn from this phase to prepare for the next. As always, it's a pleasure to welcome Dr. James Hildreth, President and CEO of Meharry Medical College, who's here to share his insights about the coronavirus and our community's response to the disease. As a renowned infectious disease expert, Dr. Hildreth has provided valuable expertise to the NFL during its reopening this season. And as we approach the end of September, I always want to remind all Nashvillians of the importance of being counted in the 2020 census. Your census response is protected by law and will never be shared with law enforcement or immigration agencies. To learn more, visit 2020census.gov or call 844-3030-2020. And remember, each resident counted is worth $10,000 for our schools and infrastructure over the next decade. So please visit online or call today to get counted. And now we'll turn it over to Dr. Alex Jehangir, Chair of the Metro Coronavirus Task Force. Thank you.
Good morning. Thank you, Mayor. And here's some additional information around the COVID-19 in Davidson County. This morning, the seven-day average of new cases per 100,000 residents is 15.6. While this is not close to the high of 65 we hit over the summer, our goal is that this metric gets at or below 10. As we explained last week, around 270 of our recent cases have come from correctional facilities in our city. These cases do impact our metrics. However, the new cases are not what is considered community spread, meaning they are less of a threat to cause the virus to be increased in our general public. One metric that is looking better today is ICU bed capacity. Today, that number is 20%, and we have been at this mark for most of the week. This is the first time since late July that this metric has been this high. Today, we have 114 individuals in Nashville hospitals with COVID-19. We have been consistently around this number since the beginning of the month. This is well below our peak of 222 individuals back in July. And remember, Nashville is a healthcare hub, so these individuals are not just from Nashville. These are individuals affected with COVID from all over our region. Finally, the World Health Organization recommends that before a region can relax restrictions, the test positive rate from a comprehensive testing program, such as the one we have here in Nashville, should ideally be at 5%. Today, our 7-day percent positive is 5.1%, which is the lowest it has been since March. Now, this is a solid number, as last week we conducted a robust number of tests, over 16,000. Now, this morning, the mayor announced some additional steps we are taking as a city on our roadmap to reopening. Members of the coronavirus task force have been working with the mayor to analyze the data to help him make the decision needed to open up. I've spoken with the heads of each hospital system in the city, and they have reported their systems are doing well. Furthermore, they all agree with the adjustments announced this morning, as have members of our public health team and other experts we have been working with. Now, I know some people are thinking we're moving too fast, and also some people are thinking we're moving way too slow. We believe these adjustments strike the proper balance between protecting our residents and opening up back our economy. Now, these steps don't mean that we are back to normal. In fact, we are far from that. Remember, we've been here before. We've opened back up and then had to adjust back to a modified phase 2. Now, we don't want to have to pull back, but if the numbers show that the virus is spreading, then we very well may pull back. Now, this is not what we want to do, so please do your part. Stay at home if possible, wear a mask and socially distance when in public, and wash your hands. And if you come in contact with someone that has tested positive or you have any concerns, get tested yourself. As a reminder, our community assessment centers are open 5 days a week from 7 a.m. to 1 p.m., Monday through Friday. Testing is free, and you typically get your results back in a couple of days. Also, in order to increase the availability of testing for our students, our parents, our teachers, our staff, as well as our community in general, the Metro Public Health Department is working closely with MNPS to provide extended hours and additional locations for testing. We will have more information regarding this very soon. Now look, I thank all of you for the sacrifices you've been making over the past 6 months. I know it's been very hard, and I know that this virus will be with us for the foreseeable future. So Nashville, please don't give up. Please stay focused and stay the course. I now would like to introduce Dr. James Hildreth. Thank you.
Good morning, Nashville. Over the last few weeks, there have been quite a few stories about COVID-19 vaccines. The first thing that must be stated is while all of us would like to see a vaccine come online as soon as possible, it is highly unlikely that a vaccine will be available for widespread distribution by early November. The good news, though, is that as I stand here and speak with you today, at least 150 vaccine candidates are being investigated around the globe. Indeed, probably every conceivable scientific approach to developing a vaccine is being evaluated somewhere in the world. The even better news is that several vaccine candidates are now enrolling in phase 3 trials to confirm their safety and efficacy. These large trials are really important to determining whether vaccines are safe and effective. Indeed, in the vaccines being developed by the National Institutes of Health in partnerships with big drug companies, the goal is to enroll 30,000 individuals in each of those trials. I'm excited to know that Nashville is going to be a major site for COVID-19 testing. Meharry Medical College, Vanderbilt University Medical Center, Clinical Research Associates in partnership with the Health Department will all be enrolling participants for at least 4 vaccine candidates. And when all vaccines trials in Nashville are fully enrolled, there may be as many as 2,000 Nashvillians in the trials. The results of these phase 3 trials, as I said before, are critically important in determining whether vaccines are safe and effective. And since enrollment in such large numbers in so many sites will take weeks to do, and since you have to wait some number of weeks to know whether or not the vaccinees have been protected, it's highly unlikely that all of that can happen between now and early November. It's possible, but unlikely. I would also like to emphasize something you've heard before, that it's critically important that the participants in the trials reflect the entire U.S. population, because indeed some of us are more vulnerable to the vaccine, to the virus than others. And it's really important that those individuals who are most vulnerable be evaluated in the trials. The reason for this is that although the human immune system is generally the same across races and genders, there are some subtle differences, and the only way to know that a vaccine works in a certain population is to test it in that population. And unfortunately, those who are most vulnerable to the virus are the least likely to be accepting of a vaccine. As some of you know, that some horrible atrocities have been visited upon African Americans for the last 4 centuries, so understandably, they're apprehensive about participating in medical research. So we must make a concerted effort to gain their trust and make sure that they can participate comfortably. Given that a COVID vaccine is not likely to be available anytime soon, that means we have to get comfortable with mitigating the virus for several more months. Thankfully, here in Nashville and lots of other communities around the country, we've demonstrated that we can do that with the tools available to us. And actually, 6 of the 8 metrics that have guided our decisions are now in the green. And as Dr. Jahangir just shared with you, the numbers are looking really good. But we must not get complacent. The one number I would love to see us get control of is the number of cases per 100,000 population. We need to get that below 10. That's really important. Because if it's below 10, that means that 1 in 10,000 individuals are infected, and the likelihood of transmission goes way, way down. The last thing I want to mention is the flu season is upon us, and the idea of having a significant flu epidemic on top of a COVID-19 epidemic is a very scary one indeed. So I'd like to encourage everyone who is able to get a flu vaccine to keep us from having 2 twin epidemics at the same time in our community. So Nashville, we've got this. We know what we need to do. Wear face masks, do social distancing, wash hands frequently, avoid large crowds, and we can put this virus behind us. And with that, I'd like to introduce Dr. Adrian Battle, Director of Metro Nashville Public Schools.
Mayor Cooper, thank you for the opportunity to speak here today and provide an update on Metro Nashville Public Schools high school sports. I appreciate that our newly elected school board chair, Christian Buggs, is here today to represent our highly engaged and supportive school board. With the update of the city moving into the next phase of reopening today, our postponement, not cancellation, of athletic competitions, and after a long summer than anyone wanted, we are ready for sports that make the fall so enjoyable. And I know, because I played sports as a Metro Nashville Public School student, volleyball in the fall, basketball in the winter, and track and field in the spring. As a district and a city, we weren't ready for competitive sports or other extracurricular activities when school started more than 7 weeks ago. As seen in high schools across the state and country, the health risks were too high in our community for contact sports or other close gatherings of student athletes. But now, after a long summer and a lot of progress against COVID-19, we've determined that our teams can play in a way that's safer for our players and our coaches. So I'm very excited to announce that we are phasing in the start of our athletic seasons with high school football able to start next Friday, September 25th, girls soccer on Wednesday, September 23rd, golf, probably the most socially distanced sport of all, is already underway with competitive tournaments, and cross country and volleyball have been practicing and conditioning and are getting ready to start their season soon. I'm proud to be able to say that high school students will be able to participate in sports and other extracurricular activities in person, whether they attend school in person or remain in the virtual environment. However, it is important to note that we will continue to expect our teams to practice all safety measures, observe social distancing, and we will comply with all guidance related to isolation and quarantining due to positive cases and close contacts, which could result in cancellation of games or seasons. We will also continue to monitor our progress, and we will make adjustments to our plan as needed. For anyone who's watched a Major League game on TV since the pandemic started, you know it's a strange experience. The absence of crowds cheering can take some time getting used to. But we're going to be able to add to the school spirit. While the health conditions mean that we're not ready to let fans attend high school games yet, due to the continuing risk of bringing a lot of people together, we will allow cheerleaders and marching bands to be at games in a way that will provide for both social distancing and a bit of game time atmosphere. And media will be allowed too. We'll have more details on that for you soon. And professional installation of live streaming technology will be completed in stadiums for home games on the 25th so that families, friends, and other fans can watch every minute and see every play. Our phase-in process for returning to school remains intact with the schedule I announced over the weekend, which calls for high school students to be able to return to the classroom in January. Parents of children in every grade will have until tomorrow, Friday, at midnight, to tell us if they want their children to return in person, starting with pre-K through second grade after fall break, or if they'll remain in the virtual learning environment. I'm excited to join Mayor Cooper and Chair Buggs in announcing that we are able to begin extracurricular activities for our student athletes, coaches, and fans. I'm also excited about the expansion of the COVID-19 testing that Dr. Jahangir mentioned. We're very grateful to Mayor Cooper and the city for this partnership. We will give our students, teachers, staff, and families more time and more opportunities to get tested after school ends each day. This partnership will allow for that. Those extra hours to get to a testing center are going to mean a lot for our people getting back to school in person and for the public health of our school district and our city. At this time, I would like to introduce Burke Nihill, President and CEO of the Tennessee Titans. Thank you.
Good morning. Welcome back, Titans fans, and thank you, Mayor Cooper. This announcement would not have been possible without your help, as well as the seamless coordination with the Metro Nashville Public Health Department. On behalf of the Titans organization and Titans fans everywhere, thank you so much for all of your teamwork and collaboration to bring fans back to Nissan Stadium. Months ago, we began the process of creating our Safe Stadium plan. We made it in conjunction with the Mayor's Office and the Health Department. This plan was designed to adapt our stadium to the latest COVID-19 health guidelines and protocols. This morning, Titans fans will be able to visit TennesseeTitans.com/SafeStadium to read a more detailed overview of the Safe Stadium plan. But I'd like to share a few highlights of the plan with you this morning. First, I would acknowledge that we are fortunate to have a large outdoor venue where we can space out our fans. Our seating bowl will be organized to socially distant seating pods, grouped in parties of 1 to 6. As mandated by the NFL, all fans must wear a mask at all times, except when actively eating and drinking. Our security team will be strictly enforcing this policy. During the game day experience, fans can expect to see over 300 hand sanitizing stations we installed at the stadium this offseason, individually wrapped food at the concession stands, and touchless bathroom fixtures. They'll see a dedicated cleaning crew in the bathrooms and near concessions, and security throughout the building enforcing our new policies. We're asking that fans arrive early to the stadium to avoid crowding at entry gates. At those gates, we will have floor clings spaced 6 feet apart to encourage social distancing in the lines. And we have fully transitioned to mobile-only ticketing, so there will be no physical contact between our staff and our fans as they scan their tickets on their mobile devices. Like Mayor Cooper, we believe a gradual increase in capacity is the best solution for reopening our stadium. For the October 4th game, we will host season ticket members up to 10% of our capacity. The next October home game will allow 12.5%, and the third, 15%. For November until the end of the season, we aim to reach 21%, which is the maximum capacity our facility can accommodate under current CDC guidelines. Of course, as we go through this process, we understand that we may need to be flexible on these capacities as we learn more information. Let there be no doubt, the health and safety of our fans, staff, and players is and always will be our top priority, particularly with COVID-19 still impacting our region and the rest of our country. While we celebrate the opening of our doors, we are laser focused on showing Nissan Stadium's guests a safe and comfortable experience while visiting our facility for Titans games, Nashville SC matches, and any other event. This is a plan that has been in development with key health experts since early spring. We've had months to prepare for this day and feel extremely confident in the Safe Stadium plan. We can't thank our fans enough for their patience and understanding throughout this process, and want to thank them in advance for their careful attention to these protocols put in place for their safety and comfort. What you see behind me here is our Tennessee Tough mural. We unveiled the mural during Titans kickoff week and dedicated it to the people of Nashville and Tennessee. To us, this mural represents tenacity, resilience, and community that we've seen throughout our region over the past 9 months. We are proud to be a part of this city, and we're confident the people of Nashville will continue to work together to get through this pandemic. Thank you, and tighten up.
Thank you, Mr. Nihil. We'll have to run over our scheduled event time just a little bit to make time for your questions, but we'll start with Nancy Amons at Channel 4.
Thank you, Chris. My question is for the mayor or for the health department. News 4 was recently denied an open records request for information when we asked about the 10 bars that had had COVID-related outbreaks. The open records response said no records existed of which 10 bars those were. Is that true, that no records existed? And has there been a deliberate attempt to withhold information about COVID numbers in bars and restaurants? Thank you.
Mayor Cooper will address your question.
Thank you. Can you hear me? Thank you, Nancy, for the question. Of course, there's no effort to withhold information. We'll do all we can to open up all information. I think the question comes with a concern that back when we were modifying phase 2, that the bar case count was not at that time super high. And I think what you're hearing is that kind of story out in the community, that the bar case count was not super high. We responded to the White House directive. If you remember that era, Dr. Birx herself flew to Phoenix and drove from city to city to ask cities to close bars. Now, we did that in advance of her actually being here, my meeting with her and Governor Lee's meeting here, but as a kind of a Paul Revere for how to deal with this spike, she drove the country and she called attention to bars, not because the outbreak was necessarily that bad at that time, but that they, because you have young people there, would be super spreader platforms. Now, she predicted in that time what has happened, that if Nashville took the appropriate action, we would do better with the disease. And if rural areas did not, that spread by young people in rural areas, those would be the worst counties in the state, and that is, frankly, what has happened. It led to Nashville, driven by public health directives and information, to include these areas that were a concern of being super spreaders. Now, in that environment, you did see pictures of hundreds of people elbow to elbow, young people in clusters shouting, which repeatedly we have talked about in this group as being a source of the greatest concern for spreading this new disease. And so we're happy to comply with any public information. The fact that back in early July you didn't have a super high case count at that moment doesn't mean that it was not a national health priority. And then let's look at what happened. From Los Angeles to Miami, everybody adopted the same protocol, and you do have nationally an improvement in case management. We're here today celebrating pretty good news for Nashville. We should not be 81st in the state. We should still be, based on our density and our population and how people live, we should still be the most affected county in this state. But we took action. We took action ahead of time in response to careful information sent to us by the White House to do what we did, and it has been effective. So again, thank you, Nancy, for your question. Of course, we're happy to share all information, but we want the right interpretation behind all of this. Thank you.
Who's next? If you'll step up to the microphone. Brett Kelman at the Tennessean.
Hi, good morning, everyone. I just want to quickly verify some information about the new bar rules and then ask a question about nursing homes.
Okay.
It sounded like the new rules take effect tomorrow and are 50% capacity or 50 people per floor and 50 people outside, depending on which of those two circumstances is less. Is that correct?
That's right. And I'll let Dr. Jahangir expound on that, but that is correct, what you said. And your next question?
Secondly, Nashville has made all this progress. We have become increasingly closer and closer to the 10 new cases per 100,000 residents threshold that the state has set for the reopening of visitation at nursing homes. It seems like we will cross that threshold sometime soon, hopefully. But I would love to hear Dr. Jahangir and Dr. Hildreth's thoughts on this pivotal moment of allowing visitors into Nashville area nursing homes where some of our most vulnerable residents exist. Do you have reservations about crossing this threshold and allowing that to resume?
Okay. All right. Thanks. Dr. Jahangir?
Hey, Brett. Thank you. The nursing home issue, as you know, is a state call, right? And so I think the state has set some metrics of what's best practices based on what they've gotten on. And so I think we as a city, every step, we look at vulnerabilities across the population, right? So going into a nursing home, I think the state has been very diligent. I think part of the reason our mortality rate in the state is lower than most places is because what Commissioner Piercy and Governor Lee have done as far as making rules to be pretty stringent. Now, as a city, we're getting lower. If we hit that threshold, then obviously, we'll follow whatever rules are set, and we'll keep an eye on it. Just like every single step of the process, we've been looking to see where issues are and addressing them. So to go back to this last question, we saw there was increases in an abnormal increase in cases at one weekend in about 7-8 places. We determined, hey, this is abnormal. Let's stop the fire in the corner before it engulfs the house, right? And I think that's the same thing with nursing homes or other things. Nursing homes, obviously, the governor's taken over, but which is fine. But I think there's always concern anytime you turn that dial. But I think if you turn that dial in a very careful manner, that is going to be hopefully where if you need to adjust it further. And nursing home thing's sad. I don't know if you guys there's a lot of loved ones that haven't been able to see their loved ones. And I hope we do get that point where we can allow guests safely back to nursing homes. So that's a long answer, but thank you.
Blake Farmer, WPLN.
Yeah, I think this is a question for Dr. Battle, and I imagine it's a question on a lot of people's minds. There's obviously been a lot of effort to make sure high school sports can get going, all while not having, it seems, the same urgency to get high schoolers back in the classroom. You referenced this a little bit, but can you expand on that? How you explain to folks the efforts to get sports back, but not in classroom, in-person instruction?
Thanks, Blake.
Thank you.
Thank you. Yes, as you mentioned, I did acknowledge that in my comments. We announced over the weekend, last week, that we are phasing in our students after fall break. We will start with our earliest learners based on their preference for in-person or virtual experiences after fall break. That will allow our school teams to rearrange and align staff to meet the needs of our students and families. So that phase in will continue actually after fall break. As we all are aware, we did start our phase in right after Labor Day with our most vulnerable population of students, which were our exceptional education students. And we, again, began that phase in after Labor Day, where families had the option of in-person and virtual learning. So we will continue that. So that phase-in actually started first. We're here today extending that phase-in for our extracurricular activities, which are also critically important for our students. We have lots of student athletes who really connect and are driven by their opportunity to engage in extracurricular activities. And so our priorities have remained the same with regards to starting first with our students and their educational experiences, and then expanding on that phase in with our extracurricular activities. We also know, based upon the information we've received today, the abundance of caution we need to take in convening large groups of students. And so with that information and understanding that what schools do naturally is convene large groups of students. And so we want to be very mindful of that, being very efficient and safe as we're phasing our students back into our schools. So I hope that answered your question.
But I'll just rule, and I'm sure you remember saying this, that if it's not safe enough for kids to go back in person, then it's not safe enough for them to play sports. What's changed since then?
So as was mentioned today, we have made some progress in our city with regards to COVID-19. And to kind of counter your comment there, we are allowing families who choose, that's their preference for in-person learning, to make that choice so that students can learn face-to-face if they feel it's safe for them to do so. So just like our athletic opportunities, extracurricular opportunities, our families have a choice. And if they so choose to send their students back to face-to-face, and we know how critically important it is to have those face-to-face learning opportunities for our students, our families can choose to do so.
But high schoolers cannot choose until the first of the year. I mean, that feels a long way away to a lot of folks.
Yeah. No, great question. Our high school students right now, just like all of our pre-K through 8 students, are selecting, making their preferences with regards to their in-person or virtual experience. What we have in our high school students right now, one, they're on a 4x4 schedule, which means their classes are accelerated based upon the AB schedule block that our students have been in the past. So essentially a change for our high school students in November or towards the start of December will just be a few days before exams, given the classes that they're in. We also know that our high schools has the highest number of students who will be reconvening back in those facilities. And we also know the data and research with regards to our older students and the likelihood of transmission of the virus. And so we want to be very thoughtful about that. In addition to, and I think it's important for everybody to recognize this, our students self-select their courses that they take every year. Lots of our students take very specialized courses, and so it's important for us that we not limit student access to those courses based upon the phase-in. And so we want to be very smart and efficient and equitable in our educational opportunities for our students once they phase back in January, because in a normal school year, students typically register for their courses 6 to 8 months before the start of the school year. And so we need the opportunity for our teachers and for our school leaders to shift schedules to meet the requests of our families with regards to in-person versus virtual in the high school setting. Thank you.
Thank you for the question. Just to follow on and share my own observation when Dr. Battle was explaining this. This is all outside. Both students and staff are very much on board, following a strict social distancing protocol. This is the first step for the reopening. This is the lowest amount of risk being managed very well, and we have to start. We have to start in this great work of trying to get everybody back to school, and this is minimizing the risk and maximizing some student opportunity, and actually, to me, feels very consistent with a get back to school plan. So, thank you.
Is that Chris Davis? Additional
is.
thought?
Yeah, my question is for Mr. Nihil regarding reopening to fans here at Nissan Stadium. So, number one, will it be open to just season ticket holders for these tickets, and how will those tickets be selected, since there will probably be a lot of demand for that? And number two, obviously, you've mentioned that the capacity will ramp up if things go well. What is the threshold for that success? And will there be some contact tracing apparatus at Nissan to be able to judge that success?
Thank you.
All right, let me see if I can keep track of all three of these questions. So first question, yes, we are going to be communicating later today a plan to get those tickets in the hands of our season ticket members. Second question was with respect to just monitoring for success. That'll be a continued collaboration with the health department and the mayor's office. And then the third question, I believe, was related to contact tracing. We have had some conversations with the health department about how the Ticketmaster technology and understanding where particular people are sitting in seats would be able to help contact tracing efforts. So it's been preliminary, but we do think that there's some advantages to being able to contact trace in our setting as opposed to a restaurant, for example.
Mayor Fox 17 for Mayor Cooper. Emails released between the mayor's office and the health department suggest at least a reluctance to share COVID-19 numbers that don't support policy. To paraphrase, we don't want to release those numbers because they are low. We're talking about bars and restaurants. And if you do say this is out of context, we did ask for context yesterday and we're told not just no comment, but FOIA us. And that doesn't really feel like a we're all in this together comment. It's adversarial, and don't you think that the bar and restaurant owners, some who are going out of business every week, deserve to know that there were around 80 cases? Shouldn't that be widespread, disseminated by the office? We talked about sharing good news. That was pretty good news.
Thanks for your question, Dennis. As I talked to your production team yesterday, when you asked for that comment, you sent over 9 screenshots of documents that you had asked me to verify. I told your production team that needed to go through the proper channels, which is a public records request, because that's what needs to be done, to go through line by line and make sure that those documents were verified the right way. I wasn't putting your team off. That is something that our office cannot do. That's something that needs to go through the Metro Clerk's office. I would have done that with any request of that nature. And when you asked for comment, there was actually absolutely no context for the comment that you requested. It was simply 9 screenshots and asking for comment. After you formulated your story, it would have been nice to have an opportunity for the mayor's office to participate in that story. And I think it was a lapse in journalistic judgment and due diligence. In terms of your question, I'm going to let Dr. Jahangir participate in responding first.
Let me ask, since
you asked the question.
I'm going to let Dr.
Jahangir
comment. I'd like to make one about you. When you call after the newscast and say, gee, we wish you would have asked again. I mean, this isn't high school. You're not asking a girl out on a date again who said no. If you don't have a comment up front, we don't have to come and ask you again an hour later. We have deadlines, and I'm asking you now. So here's a chance to answer.
No. Yeah, you had a deadline, and you asked a question.
And you didn't answer. You said FOIA us, sir. And
yes,
so we did, and we
Dennis,
went with what we had.
you're not, no, I'm sorry. Excuse me. You're not listening. I just responded to your question. You asked a question. You asked for me for a comment without context. You asked me to verify documents. I told your assignment editor, Jen Bellissimo, that I could not do that. I gave her the proper channels in which to do that. She went through another channel, did not notify me that she had done that, and you ran your story.
Absolutely.
Without coming back to ask me for comment. You said that
we're
the mayor's
asking
office...
you now. We ran the story. We asked you before. We're asking you afterwards. And it's so funny that a Metro staff attorney validated these emails in 1 hour that you told us to FOIA.
Right. Okay. And you know what? That's fine. But what you should have done was to come back, tell me that you had validated those emails in whatever way that in whatever way that you did.
Because you
without
wouldn't, you
coming
told
through
us to FOIA it, sir. You said go through legal channels to extract this information because we don't want to share it.
Sir, okay,
I'll
this is
argue with you all day, but
and-
you're not gonna talk to me like this and walk away. I will talk back to you the same tone that this is, this
Excuse
is
me.
America and the people have the right to know the real COVID number. Don't shake your head.
Okay.
Because
And-
people
and
are
this is the
wondering,
way-
are you
And this is
listening to what people
and what
are
I
saying?
told your producer was the proper way to do it. So I'm going to let Dr. Jahangier now answer your question. Thank you.
Thank you, Dennis. Come see me. We'll get to the bottom of this. I do want some of our distinguished guests to be able to finish the press conference.
course.
Please come see me with any concern. We'll get to the bottom of this. Thank you.
Alexandria Adams, News 4. I was wondering, this is a Titans-related question, will Metro Health officials be at any of these games to ensure that those fans are following safety protocols? And are there any consequences that for those who don't?
Well, I'd love for Dr. Caldwell to come and answer that. Yes, of course. Any large event we're going to be monitoring. I'd like his response to. It is, of course, a concern. We are taking a known and limited risk, but to follow on Dr. Hildreth, vaccine's not going to be ready for a little while. We have an economy and a city that has to be functional as safely as possible. We're trying to find that sweet spot to be able to do it. We're interested in any problem of execution. We can always do better. I plan not to go to the game, but I want to be in the parking lot and thank people for socially distancing and handing out a mask to anybody that might ever need a mask. Let's all do that so that we can get back to work sooner. It's a great achievement to go from first worst to 81st. We have to continue that progress going forward. It's a daily question of listening and improving. And again, I'd love to get Dr. Caldwell's response.
Good morning. We're going to be monitoring every one of the events, and this is a good opportunity to let everybody know that wants to do an event that we have a process in place now. Any event over 25, please just go to the covid19.nashville.gov website. You can also get to it at asafenashville.org. If you scroll to the bottom of that page, you can click on a button to submit your event. Any events over 25 need to be approved, and they will be reviewed, and we will monitor them. So this event will just be like any of those other events. You know, we have monitoring teams in place. We are on Broadway every Friday and Saturday now, and we will be wherever there are other events monitoring, and success will be determined by how well we see compliance with face mask usage at all times, with social distance at all times, with minimal use of alcohol and good judgment at all times. And we always give preference to events that are outdoor as opposed to indoor. Just to remind, that is the Fearsome Four. The Fearsome Four are no face masks, no social distancing, indoor events with lots of alcohol. We'd like to get away from that, and we will be monitoring and working in partnership with everybody to develop a reopening plan with each of these event venues in a slow, calculated way. We're really excited about today's announcement, and we really look forward to opening up more spaces.
And one more question. This is directed for Dr. Hildreth. If school bus drivers have COVID-19, could they pass it along to children on the school bus, and how easily or not would it be to spread COVID-19 on a school bus or an MTA bus?
Sorry, it was hard behind the speaker to hear. School bus drivers, is that the question? Okay, thank you. Anyone that has COVID can spread it to someone else, right? So wearing masks is critical. If you have any concern that you may be infected, don't go to work. Get tested, socially isolate. There's always a risk. I mean, I think to say that there's no risk of, anyone who has it spreading someone else would be a misnomer, right? You have to say it. So that's why wearing a mask, as much as possible social distancing and not cross-contaminating is critical. So there we go. Thanks.
Thanks, everyone. That's all the time we have for questions this morning. Thank you to all our guest speakers. The next Metro COVID-19 press briefing will air on Thursday, September 24th at 9:30 a.m. Please stay safe. Thank you, everyone, for coming out today.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.